Have you ever noticed something unexpected when you use the restroom, like a change in color or a surprising pinkish tint? It can be a little alarming, and often, the first thought might be to wonder what it means for your health. Understanding what these changes could signify is key to your peace of mind. Yes, blood in the urine, known medically as hematuria, can indeed be a sign of bladder cancer, and it is actually the most common symptom. While it does not automatically mean you have cancer, it is a symptom that always warrants immediate medical evaluation. Catching any potential issue early is incredibly important for the best outcomes. The reason blood appears in the urine with bladder cancer is often due to the tumor itself. Bladder tumors are essentially abnormal growths of cells within the lining of the bladder. These growths are typically quite fragile and have an increased number of small, delicate blood vessels. As urine passes through the bladder, or as the bladder contracts, these fragile vessels can easily break, releasing blood into the urine. Even a tiny amount of blood, too small to see with the naked eye, can be detected through a simple urine test. It is important to remember that blood in urine can also be caused by many other less serious conditions, such as urinary tract infections, kidney stones, or even strenuous exercise, which is why a proper diagnosis is so crucial. If you notice any blood in your urine, whether it is visible or discovered during a routine test, the most important step is to schedule an appointment with your doctor right away. They will likely start with a thorough medical history and physical exam, followed by a urine test to confirm the presence of blood and check for infection. Depending on these initial findings, your doctor might recommend further imaging tests, such as an ultrasound or a CT scan, or a procedure called a cystoscopy. A cystoscopy involves a doctor using a thin, flexible tube with a camera to look inside your bladder for any abnormalities. This careful approach helps pinpoint the exact cause. One interesting aspect to be aware of is that blood in the urine from bladder cancer is often intermittent and painless. This means it can come and go, and you might not experience any discomfort at all, which can unfortunately lead some people to delay seeking care. Don't fall into this trap. Also, keep in mind that hematuria can be either gross, meaning you can see it, or microscopic, meaning it is only visible under a microscope, both forms requiring investigation. Early detection through prompt attention to symptoms, even if they seem minor or temporary, significantly improves treatment success rates. Understanding that blood in the urine is a warning signal, not necessarily a definitive diagnosis, empowers you to take proactive steps for your health. By seeking timely medical attention, you ensure that any underlying condition, whether it is a simple infection or a more serious issue like bladder cancer, is identified and addressed as early as possible. Your well-being is always the top priority, and quick action can make all the difference.